Hello, my name is Bob Rosell with Edgewater. I'm going to discuss the population health discovery application today. The population health discovery is important because it's the hub of understanding how to treat, diagnose, and manage patients. And understanding healthcare management and service effectiveness is a key metric that drives organizations. By implementing effective ACO analytics, organizations can gain deeper visibility into key metrics driving quality care, including ACO performance and measures, hierarchical aggregation of performance from ACO to patient encounter, cohort comparison against baseline performance, historical trends of provider care, contribution margin across hierarchy and time. When we built the application, we settled on open source technology, specifically a product called Solar from Apache and a framework called Angular 2 driven out of Google, but a community product. We felt that the content of open source technologies is far more diverse than what can be produced by a single company. It eliminates upfront license costs, removing license as a barrier to adoption within your organization, and it improves security and quality by allowing us to have access to the underlying code. What are the key features? Free text and guided search. We'll show you this during the demo, but we have the ability to search across notes and also standard structured information, such as encounter information, provider information, diagnosis information. It's a proven methodology. We have over 25 years of experience in healthcare, and it's blazing fast. You'll see that. So some of the key benefits is a rapid startup, zero license costs, open source, can run standalone or integrated into your Hadoop infrastructure. It's built for performance, and it's an extensible framework. It can be moved beyond just the application you're seeing, both in terms of functionality and in terms of subject matter domain. So now let's do a demo. So what I'm showing you on the screen is the landing page for the population health discovery application. And this is a pretty standard layout. So up at the top are how you choose other applications, and then right below that are the pages. So we have 3 pages. We have encounter, encounter notes, and encounter comparison. The encounter page, right below that has a search box. So for example, I could type in, mitral, looking for mitral valve information, and filter on that. As you can see, everything updates immediately. That was a free text search. The filter bar shows you your current state of breadcrumbs. Then a summary bar giving some key KPI information, encounter, patient, age at admission, total reimbursement, both the sum and the average, direct cost, sum and average, and finally the distance that the patient was from the location where he was encountered. The left side is what we refer to as guided search or faceted navigation. What it is all the attributes that have been entered into the system are available. You can see that typically what we do is we just provide the values and a count of the number of documents that have that value currently. We also have what we call a range. So what we've done with age at admission is we've broken it into 10-year segments to make it a little bit easier to search on. So if you wanted to search on somebody that was, let's say, 40 to 50 years old, you could do that. And again, you can take that right back off, either by going to the filter bar or by clicking on the attribute again within the guided navigation. The other thing that we have available to us is, and let me show it using provider, the ability to do a negative search. So, for example, if you wanted to exclude a practice, you can do that. And you can see in the filter bar it shows up in red. So the information all updated now that all the documents are provided except those documents that are for that practice. On the page, we give you 2 charts. The first chart is a bar chart, and you can see that you're able to change the dimension, essentially your x-axis in a bar chart, to other dimensions, within the encounter information. You can change since this is a stacked bar, you can change the series value that's being used for stacking. You can see that. For example, moved it over to level 2. And you can change the metric that you're looking at. So by default, it's encounter. You could move it to patient. You could move it to total reimbursement. Again, this is configurable. We could move beyond these 4 values. The chart on the right is built upon the premise of being able to look at like CMS ACO metrics. For example, we can look at some of the same information we were looking at before. We can also move on to something like clinical depression screening, BMI screening, really your CMS ACO metrics, high blood pressure screening. The one thing I haven't pointed out yet is that the charts themselves are hot. So if I click on the chart, I now have high blood pressure screening no as one of my filters, and you can see that all the information on the screen updated. The other charts, the other tables. Below that, we have 4 tabs of data. We have your ACO performance data, level 1, practice name, patient, encounter, total reimbursements, total direct costs, MDC, again, patient, encounter, total reimbursement, total direct costs. This is all configurable. If you want to include other metrics, we can do that. Provider profile by diagnosis group and procedure code. Patient profile by HIC number, provider specialty, total reimbursement, total direct costs and sum, and then a heat map of the locations that the patients have been to. Again, these tables are hot also, so if I click on the HIC number, I immediately filter down to that HIC number, and you can see all the information on the screen updated. And I can either take that off by clicking on it again or clicking in the filter bar. And then the 4th tab is encounter details. This is the information was loaded at the encounter level. So this is all the information available to us at the encounter level. So I could look at the diagnosis information. I could look at the procedure information. This is, in this example, it's primary diagnosis, primary procedure, patient information. And again, this information is hot. So for example, if you wanted to cut down by gender, you could do that there. Click on it again to remove it. And the headers are sortable. The other 2 pages are access to your notes. We've loaded operation notes for demonstration purposes. You again still have access to being able to slice and dice by structured information when you're on this page. The 2 pages join up. I can show you that. So if we filter on this page, when we come over to this page, the filter carries. Take that back off. Encounter comparison gives us the ability to take the encounter data and compare it against itself. So for example, let's say I wanted to look at 2 different diagnosis groups. Say I wanted to look at diseases of circulation and compare that against another diagnosis group, just to try to get a feel for something. And this is very ad hoc, and you can choose. So let's say I want to compare it against diseases of musculature. So now I'm comparing state 1 and state 2. State 1's my left side, state 2's my right side. You see that by the numbers in the components. And I can, in the middle, I can do comparison chart, looking at different things, a year, quarter. Again, this is configurable. We could add other metrics and other dimensions. Tag cloud. So we could compare, just very quickly visually. And details. So we can look down into the details of the 2 sets. It's really one set of data carrying 2 different states, or 2 different sets of parameters against it. And you have your summary bars up here helping you with that. And then the encounter filters are shown on either side. Okay, what I'd like to do now is go through a use case. So let's pretend I'm an ACO practice director, and I've done some reading and also had some emails sent to me concerning Gore-Tex, and specifically concerning Gore-Tex in repair situations, cardiovascular repair. And I want to investigate whether we're having some similar problems. What I'd like to do now is I'd like to isolate myself to a subset of the data. So first, why don't we limit ourselves to New England ACO. So I'm practice director for New England ACO. So I've immediately filtered that using the hot feature of the table. Now, I want to work with providers that are specializing in cardiology. So again, I filter by that. What I've done here is not anything that's that far beyond traditional BI. I've used structured information, and I've filtered a set of data, creating a cohort based upon structured information. I'd like to move beyond that now. What I'd like to do is combine that with an unstructured search. So what I want to do is type in the word Gore-Tex. But I want to move beyond that. I want to do what's called a proximity search. I want to find in the notes anywhere the word Gore-Tex is within 10 words of the word repair. And there's a syntax for that I can type right into the search box, hit enter, and the data has been filtered down to about 1,500 encounters. And we can go over and look at the encounter notes, and we can in fact see that this is actually happening. The word Gore-Tex is showing up within 10 words of the word repair, or vice versa. Now, I need to filter down further to actually try to understand what's going on. And one of the things I want to do is I want to use the CMS ACO metrics. And if I look specifically at the mortality metric, the one that says, was the patient alive within 30 days of post-discharge? Fortunately, the data we're looking at now, there's only no's and yeses. We also know that this information can be ambiguous. But let's specifically look at people that we know have died. Now, I'm down to 36 sets of notes. I could, now that this filter, since the filters carry, I could have moved back to the encounter level. It's 36 encounters, 36 patients. I could have take this cohort over to here to compare it against a baseline. What I'm going to do is I'm going to just look at the data within the notes and look at the data associated with the notes, the encounter information. I could look at location. I could try to look for some clue within the location. Marlborough, Southborough. Looks like some of these things are happening in Southborough, but they're also happening in Westborough. Maybe there's something there. Maybe there's a pattern emerging. I could also look at the provider. Now I'm seeing, let's see, Janet Christie, Janet Christie, Janet Christie, Janet Christie. I'm seeing a pattern emerge in the data. Now, this is not the end-all or be-all, but this is a tool of discovery. It got me further than I would have been able to do on my own in a traditional BI setting with only maybe structured content available to me. I was able to do ad hoc searching. I was able to do a proximity search, and I was able to get to an understanding that there's something going on with patients associated with Janet Christie, associated with Gore-Tex, associated with the word repair within 10 words of Gore-Tex, within my ACO in the cardiology specialty. That's a real head start. Now, there's obviously more root cause analysis. This tool can be used. Obviously, deeper dive tools can be used. Interviewing with Janet Christie, looking at the operating procedures, looking at the standard operating procedures. This is a head start, and we feel that you can get further with this faster than you would have been able to traditionally. That will end the demo. So if you're interested in contacting us, I'll put the information up on the screen. My name is Bob Roselle, but to contact us, please contact Dave Haggerty, 781-213-9864, or D. Haggerty, DHEGARTY, at edgewater.com. Thank you for your time.